Do you wish you could last a little longer in bed? If you're done before the party even gets started, you're not alone. Ooh. One of the most common things we get asked at Restorative Health Clinic is how to treat premature ejaculation. I'm Melissa Hadley-Barratt, sexologist, nurse practitioner, and I would like to help you understand what's actually going on and what the different treatment options are. So first up, do you even know what's normal? Most people don't. And this is even more complicated by the unrealistic sex scenes in pornography and Hollywood movies. According to the research, the average time from penetration to ejaculation is just under 6 minutes, 5.7 minutes to be exact. Research also shows that people want sex to last longer, somewhere between 7 to 13 minutes. The most important thing is that you and your partner are happy. So if you last 1 minute or 20 minutes, it's irrelevant as long as you're all happy. But if you aren't, then please keep listening. So what is the official definition of premature ejaculation? Well, it has 3 main criteria. The number 1 is ejaculation less than 2 minutes after penetration. Number 2 is the inability to delay ejaculation at almost every sexual encounter. And number 3, is it causing you distress, anxiety, or frustration? So how common is it? 30% of men have PE, but only 9% ask for help from a healthcare professional, which I find really sad since there are lots of interventions that can help. If you'd like to listen to someone's real life experience, then go to the Penis Project podcast and there'll be a link down the bottom of this video in the description. There are 2 types of PE. There's primary PE, and this is when it's been there ever since your first sexual experience. Secondary or acquired PE is when it starts much later in life and your ejaculation time was all good previously. So if sex was going well and then you started having an orgasm under 2 to 3 minutes, maybe you have secondary PE. It's mostly neurological. PE often relates to how your body processes serotonin, a brain chemical that helps delay ejaculation. In men with PE, the receptors that respond to serotonin don't work quite as well as they should. So the ejaculation reflex, which is coordinated by the spinal cord, gets triggered too quickly, and in response to stimulation, and wham, it's all over before you even get going. So what are the treatment options? The good news is there's lots. At Restorative Health Clinic, we usually recommend a combination of all the options for the best results. So you can get topical delay sprays and condoms. This is one of the easiest starting points that you can do. The topical numbing agents reduce sensitivity, as does wearing a condom. The one that we usually recommend is Steady Freddy because it was invented by an Australian doctor and it has a unique formula that doesn't make your partner numb, which, let's face it, is a big bonus. There are lots of other delay sprays you can try and see what works best for you. Most can be bought over the counter and do not even require a prescription. There have also been lots of clinical studies on delay sprays and they've been shown to be effective for many men. Or a simple barrier technique to try is just to wear a condom. Often this can reduce the sensitivity enough to keep you going a bit longer and has the added bonus of protecting you from sexually transmitted infections. So a simple technique to delay ejaculation with a partner is to masturbate a couple of hours prior to sex. There isn't any scientific evidence to support this theory, but there's plenty of anecdotal stories suggesting that it's worth a try. In my opinion, there's no harm in trying and you'll have some fun while you're doing it. So let's move on to the oral medications. So there's antidepressants. Antidepressants like escitalopram, fluoxetine, sertraline and paroxetine from a family of medications called SSRIs can be very effective in preventing premature ejaculation. The reason is they increase serotonin and in doing so, they delay ejaculation. They're usually prescribed as a daily dose, but you'll need to wait 2 to 3 weeks to see if they're going to work for you. Some men get side effects such as nausea, fatigue or reduced libido, but these usually fade after a few weeks. There's also on-demand options like clomipramine, which I can never say, taken 2 to 6 hours before sex, and this is not a therapy that we use at Restorative Health Clinic. Duloxetine, which also goes under the brand name Prilogy, is effective but expensive. It's not available in the US, but it is available in Australia and many other countries, and you take it 1 to 3 hours before sex. There's other off-label medications. Tramadol, which is actually a painkiller, delays ejaculation if taken 1 to 2 hours before sex. But there's a caution with this because it can be habit-forming and the side effects aren't pleasant. Alpha blockers, usually given for prostate issues, have been found to have an effect on PE. Unfortunately, one of the side effects is retrograde ejaculation, which means you don't have much volume or it doesn't come out anymore, it goes back into your bladder. And this could create some long-term issues if you're planning on having children. Psychological and behaviour therapy. So PE can certainly have a psychological component. Anxiety, performance pressure or past trauma can all play a role. There's lots of different behavioural techniques like the stop-start technique, the squeeze method, mindfulness and pelvic floor training. They can all be very effective, especially when they're used in combination with other treatments that we've already talked about. So at Restorative Health Clinic, we often prescribe these techniques hand in hand with one of the others. The other thing to consider is, what about erectile dysfunction? Often erectile dysfunction and premature ejaculation occur together, which is extremely frustrating and embarrassing for most men. If this is a problem for you, then treat the ED first, because it might just be that you're worried it's going to go down, so you're telling him to hurry up and get the job done before it's too late. This is why we often prescribe PDE5 inhibitors like sildenafil, tadalafil, vardenafil in combination with these other treatments. I really hope that you've learnt something new in this video and that you have the confidence to ask for help. Please don't suffer in silence, or worse, avoid intimacy, as this is not a difficult issue to treat. We have lots of men that get excellent results when they find the treatment regime that's right for them, just like the guy in the podcast 191. So please listen to him. And finally, please remember that penetrative sex isn't the only kind of sex that counts. Talk to your partner. Maybe they prefer other types of stimulation, such as oral, manual, toys. The options are endless. Explore them and you might be surprised to find out there's a lot more to sex than penetration.